This is Dr. Rashmi and let's talk about leucorrhea. So leucorrhea is nothing but the whitish discharge or yellowish discharge of mucous membrane through the vagina. So we will see homeopathic remedies related to leucorrhea. First, alumina. So why alumina is very important in leucorrhea? There are mainly three reasons why alumina patient suffers from leucorrhea. The first and very important reason is recurrent infection, both systemic and local. There is abnormal craving of charcoal, then chalk, mud, etc. Second most important reason is lack of exercise, and the third reason is anemia. Here the discharges are acrid, then profuse, transparent, ropey, as well as there is burning sensation in the genitalia. Yellowish mucus runs through the medial aspect of the thigh down to the heels with scanty delayed and pale menses. Your patient is very much exhausted after the menses and leucorrhea, and the leucorrhea is present with constipation and anemia. Alumina patient has dryness of all the mucous membrane, the skin and the vagina, and the complaints aggravate in the morning and relieved by washing the parts with cold water. So this was all about the leucorrhea of alumina. Now we will see the leucorrhea of borax. So the leucorrhea of borax is like white of an egg with the sensation as if there is hot fluid flowing through the genitalia. Here the menses are too soon profuse with the gripping sensation in the abdomen, as well as the pain is extending to the small of an back, and here the leucorrhea is especially present after the menses. Membranous dysmenorrhea with pain in breast during the menses indicates the remedy, and here the complaints are aggravated from the downward motion and relieved by washing the parts with cold water. Now let's see about the leucorrhea of creosotum. During the flow of leucorrhea, there is corrosive itching within the vulva. There is burning and swelling of labia with violent itching between the labia and the thighs. The causes of leucorrhea in creosotum are poor general health before puberty and unclean personal hygiene with anemia. The discharges are yellow, acrid and with odor of green corn, and it gets worse between the menses. The menses are too early, prolonged and intermittent. Also, the leucorrhea is offensive and intermittent. Now let's talk about the leucorrhea of natural mode. So, the prolapse of uterus causes the cervical erosion and chronic cervicitis. These are the most important reasons of leucorrhea in natural mode. Paris women during the childbearing period becomes the victim of this disease. Also, the use of oral contraceptives may cause leucorrhea. Here the menses are irregular and too profuse in nature. The discharges of leucorrhea are acrid, watery and worse in the morning. Here, the leucorrhea in the beginning is whitish and later it becomes green. The patient is very sensitive as far as the genitalia is concerned due to the dryness of vagina. Now lastly we will see the leucorrhea of remedy, cilicia. In cilicia, we can see that there is leucorrhea instead of menses, and the leucorrhea is acrid and milky with urination. There is intense itching of vulva and vagina, and the parts are very sensitive. There is discharges of blood between the menstrual periods, and the bloody discharges and bloody secretions seen every time when the child is nursed. Cervical, perineal tear and vaginal cyst is the main causes of leucorrhea, and there is lack of assimilation. That's why the patient suffers from anemia. So this was all about the menstrual disorders and homeopathic remedies related to menstrual disorders. For more updates, stay tuned. Thank you.